Understanding addiction. Hi, my name is Jenith and I'm an addictions counselor in the Winnipeg area. I have decided to do a series of videos to help people understand more completely the dynamics of the disease of addiction. I'm going to address how addictions commonly develop, and will also focus on some practices that can be used to overcome addiction. Anytime I refer to a substance or drug of choice, please feel free to substitute food, gambling, sex, shopping, or any other habitual coping behaviors. Today, we are going to look at some of the symptoms of addiction. The first criteria is having trouble stopping or controlling your using of substances. It's easy to describe this potential situation. Think of someone heading out for the evening with friends with the intention that they are going to have a couple of drinks and be home at a reasonable hour so they can get up for work in the morning. This person then finds themselves at 2 a.m. waiting for last call. While staying for last call is a reasonable thing to do every once in a while, if your intention when you headed out was only to have a few, then perhaps you're having trouble controlling your drinking. For some, once the substance had been ingested, control is lost over stopping, and this can signify a problem. The second criteria is being obsessed or preoccupied with getting, having, and using the substance. Again, we can come up with a scenario that represents this situation. Even if you are someone who may restrict your using to weekends, if you find yourself during the course of the week thinking longingly and constantly about the day when you get to use, this may be a warning sign. If you only feel able to get through a day because you know in 3 days you're going to be able to use, it indicates a problematic struggle. The third criteria is an increased tolerance or finding that you need more of the substance in order to get the same or original effect. I am reminded of a very common scenario that I hear in which individuals will say to me, "Well, I drink a bottle of wine at night, but it's only a bottle." When I hear someone report that, I am instantly cautious and concerned. Addiction is an insidious and progressive illness, and as such, that bottle of wine may sneakily turn into a bottle in a glass, or a bottle in a gummy, or a bottle in a bottle. The point is this amount won't magically decrease, but is almost guaranteed to progressively increase in order to get the same desired effect. The next criteria is continuing to use substances despite an increase in life problems and the experiences of overwhelming feelings of guilt and shame. If an individual repeatedly shows up hungover for work, misses work, or misses family functions or dates with friends, it's important to begin to consider that your drug of choice might be getting in the way of your life. The second part of this criteria is feeling guilt and shame over the quantity of drugs and alcohol being used. Unfortunately, this scenario provokes a cyclical pattern, and that when we begin to feel guilt and shame over our using behaviors, we tend to want to use more in order to numb the feelings of guilt and shame. The final criteria is giving up important things, activities, and friends, and in addition, finding that we are violating our own morals and values in order to get and use our drug of choice. There are all sorts of world examples to describe how this happens, but in simple terms, we start to become disconnected with ourselves and with what we want out of life. We may begin to avoid activities that were once pleasurable or important to us because we are ashamed of our using and the behaviors that shadow. I hope this video has helped clarify the symptoms of addiction and has revealed behaviors that one should look out for or they are all concerned about themselves or a loved one. Welcome to the Addictions Cafe. Help is out there and recovery is possible.